So the current situation in Papua New Guinea is they have detected an increased number of cases along our border provinces. And so that would be in our national capital district, in the West Sepik province, and in the Western province. In the Western province, of course, the proximity to Australia is, in certain places, it's about 4 kilometers distance between the Western province and Australia. So we've found that these border provinces are showing, I think, the level of spread at the moment is said to be stage 3, so widespread community transmission and difficulty performing contact tracing. Whilst in the rest of the country at the moment, there's the assumption that there is widespread community transmission. Again, the figures that are being delivered from the provinces to the National Control Centre, you can say that they're being underreported to a certain extent because of a lack of testing. But again, the reports from the National Control Centre as of yesterday all indicate throughout the rest of the country, and not including these border provinces, which are at stage 3, we are essentially in stage 2 transmission, which is widespread community transmission.
And presumably
in the rest of the country.
Vaccination is really important at this stage, yet health workers getting death threats, are being threatened. Can you tell us more about why?
With regards to Papua New Guinea and our belief in what we don't know, there is it's almost a natural belief that if you don't know something, then it might be bad for you. And it's almost inherent in our people to display a skepticism towards things that they don't understand. And so this hesitancy, whilst we can say it's largely due to ignorance, it's also due to the fact that unless they can actually see it and feel it, they will always be doubtful of whatever is there. And you can see it in the way that how they attribute natural diseases to phenomena that might be like spirits and whatnot. And this ingrained belief in the majority of our populace is extended onto these other things that are very scientific. And if you want to look at it, they cannot understand it if you don't break it down to their level and help them to come to terms with why it is beneficial for them to receive it. And so they just do not want to receive it. And the unfortunate thing is it's not just our people in the village. If you look at our vaccination coverage rate, our health worker coverage rate for single dose is about 35%, and then it's about 10% double vaccinated, and that's amongst the health workers. Who should be the most well-informed and the ones most willing to receive it. And this is nationwide, these figures.
It is interesting because PNG is no stranger to vaccines and vaccinations. How have previous inoculation drives succeeded then?
That is a very good question. When it comes to vaccinating our youth, and especially our children, our pediatric immunization program, we have achieved a lot of success because it's almost like they're more willing to allow their children to receive the vaccine, whereas the adults are so much more hesitant with regards to it. And when you look at the success of most recently the polio program with regards our re-emergence of it due to a failure of our immunization program, and then our attempt to control it again, there was so much more willingness by the public to accept this. This can be attributed to the fact that it is an established program and the appropriate education in the community had been carried out and had been pushed forward. Whereas with the COVID vaccination, you were trying to essentially immunize adults, and thinking adults with fixed and firm beliefs, and that willingness is not there. And also the novelty of the vaccine. And again, like in my earlier statement, this inherent skepticism that we have to things that we don't know. And so it is our own Everest to climb, and we have to figure out ways in which to do it. And I think we have to give props to where props are due. The National Control Centre has been trying to do this through getting the community involved, having gatherings where people come and they can listen to music or purchase food and then get vaccines, and they're creating incentives. But even then, the coverage, I think the data already shows it's not sufficient. I think as a country, we only have double vaccination. I think it's less than 1% or just about 2%.
Dr. Alfred Mel, thank you for talking to us. We really appreciate it.
Thank you very much, Yvette. Good night, everyone. Thank you for the opportunity.